And this phase from 24 to 36 weeks is when you have to apply the skills to prepare your baby's mother's body to give birth. You may already know you're going to have a non-laboring cesarean. How many times are you going to get pregnant? Don't you want to enjoy it and have a rich experience? Of course you do. Don't you want to go into the surgery feeling confident and engaged in your baby's birth? Of course you do. If you don't know if you're going to have a cesarean and you might labor, you want to prepare in case you labor. If you believe that you're going to labor and have a vaginal birth, you want to prepare her body because there's going to be a big object coming out of it. And if you're going to labor and you may have an unplanned cesarean, you still want to have the skills to work through that part of your baby's birth. So from 24 to 36 weeks, you will learn some of those birthing better skills to prepare her body. And this is where we all blink, we all cough, and can tighten up our rectum, really come into the forefront. Because our bodies are the same. You have the same number of muscles, the same bones. Our bodies move the same way. So I'll give you an example. Tighten up down there. I can do it, you can do it. Can that come out? No, of course not. So you don't want her body to be tight inside. That makes sense, and we're going to teach you how. We're going to teach you to create space in her body, to make it mobile, to help her soften inside. And why is it important to do it? Because anxiety, which is hardwired in women, and we'll talk about that later, pain, which is associated to labor, causes us as human beings to pull back and react and to tense up. Women have to have a counterintuitive response to birth. They have to open up and soften up, and your job is to help her to do that. But the way you can develop skills to help her to do that during the birth is to know her body well and to have shifted your focus from being a sexual relationship to her, which you already have, to being a father relationship to your baby that's inside her, so that you become the father that helps your baby come out of her body and reduce or prevent any trauma to either one of them. And this is very good.